The previous section showed 3 consultations. The doctor in the video sequences knew what information the computer was going to offer, but we didn't consider the impact on the patient. In this section, we're going to look at 2 scenarios in which both the GP and the patient are learning from the information presented on the computer screen. This patient is presenting with a sore throat. The GP has read recently that antibiotics do not significantly reduce symptoms or complications in sore throat. In spite of that, she's continued to prescribe them because that's what she usually does and because the patients expect it. This has made her feel uncomfortable when she thinks about it, so in this consultation she decides to use Prodigy. She's already looked to see what the patient information leaflet says.
How can I help?
I've just got a bit of a sore throat.
And how long have you had that for?
2 days now.
And does this sore throat make you feel unwell in yourself?
Well, just a bit hot, you know.
Okay. Can I have a little look? Well, I've had a look at your throat and it certainly does look rather sore. What I suggest you do is to take some paracetamols or some aspirin gargles for the pain and see how things go. I don't think antibiotics are appropriate in this circumstance. They often are of no benefit, and increasingly we're trying not to prescribe as much. What I can do is to give you an advice leaflet to explain that further. Have you got some paracetamol at home?
I do actually, I've got 1 or 2 left. I'm just going along to the chemist and get another bottle.
Oh, that's good. Here's the advice leaflet, and you take the paracetamol and see how things go and pop back if there's any problems.
Okay, thanks very much.
Using Prodigy has given more authority to the GP's decision not to prescribe, and the patient information leaflet is something for the patient to read later. In this example, the GP used Prodigy as an information source to resolve her discomfort about a prescribing habit that was challenged by new evidence. The patient information leaflet may help the patient deal with the discomfort he feels at not getting the prescription he was expecting. This is a patient with acute backache which is radiating to the thigh, but there is no pain below the knee. This GP has always recommended bed rest for acute backache. She has just started to use Prodigy and follows the back pain advice for the first time.
I've had this pain in my back for the past 2 days.
Could you tell me a little bit more about it?
Well, yes, the day before I was just moving some books about, you know, from the lot and heavy boxes. And the following on Tuesday, I just woke up and I had this pain in my back, you know.
Does it go down your leg at all?
Yeah, it's sort of got me back there. It sort of hurts right down, sort of from the hip down here into the thigh, you know.
Well, I'd like to examine you. Would you like to come over to the examination couch?
Yeah.
When I examined out your back, I found that one of the discs in your lower spine was very tender, and when you lifted your leg, that made the pain worse. This probably means you've got sciatica and indicates that you've got a problem with one of your discs. We've got a new thing on the computer, and it will print off an advice leaflet for you. Hold on a minute while I find it. Oh.
This GP was expecting the guidance to confirm her usual management. In fact, Prodigy recommends that the patient continues to mobilize and take some simple pain relief. This is a crucial stage in the consultation, and the GP has to decide quickly how to handle the conflict between what she was expecting and what has actually appeared on the screen. We'll look at 3 different endings for this consultation.
Well, that's a surprise. I was under the impression that people such as yourself who have low back pain and sciatica should actually rest in bed for a few days. But this tells me that you should actually continue with your normal activities. Look, it clearly says that if you do continue with your normal activities, you'll get better quicker.
Oh, I see, yeah.
This information is kept up to date and I'm sure is correct. How would you feel about doing as it says?
Fine.
Well, what I'll do is I'll print off a patient information leaflet and we'll see how things go for the next few days, but please come back if you have any problems.
Okay.
This is the section of the leaflet that caused the surprise.
Well, that's surprising. I was always under the impression that people with back pain and sciatica like yourself should rest in bed for a few days. But it clearly states here that the best thing to do is in fact keep mobile. Look, in fact it says that if you keep mobile you'll get better more quickly.
All right.
Having said that, I'd like to get a little bit more information about this. Can you just give me a minute while I see where they got their information from? Yes, this explains why. In this section of Prodigy, it tells you where they've got the information from national studies and from national guidelines. And it also explains that not only will you in fact get better more quickly, but you're less likely to be left with a long-term disability if you keep mobile.
Oh, that's good.
I'd be happy to give that a go. How would you feel about it?
Oh, yes, certainly, yeah.
Well, I'll print off a patient information leaflet for you, see how you go over the next few days and come back and see me if you're not improving.
Oh, fine. Okay.
This is the text of the Management Issues section of this guidance. It gives the references and the rationale that underpin the advice in Prodigy.
Well, that's surprising. I was always under the impression that people with low back pain and sciatica, like yourself, should actually rest in bed for a few days. But it clearly states here that you're better off keeping as mobile as possible. Look, it says if you keep as mobile as possible, you'll in fact get better more quickly.
Right.
Having said that, I would like to get some more information on this. If I follow the advice on the computer, it's quite a change from the advice I would normally give. And although I want you to get the best possible treatment, I really don't want you to feel that I'm experimenting on you either.
Oh, I don't want to be a guinea pig.
What I suggest we do is that you actually go home now, take some paracetamol, and I'll look into this further after surgery and phone you back later on today.
Okay, that's fine, yeah.
The GP could have used the background information that Prodigy provides, or she could have looked up some of the references that are cited in this background information. Some trainers use Prodigy like this as teaching material. Alternatively, the GP could have been encouraged to look at other information sources, or even to ask a colleague for advice. In this consultation, the GP was surprised by what she saw on the screen, and this may happen to any GP who uses Prodigy or other information tools in the consulting room. We saw her deal with this in two different ways. In one example, she accepted the advice on the screen and recommended it to the patient. The other two sequences showed her seeking corroboration from other information sources. There are two ways to deal with the discomfort that may be felt when we're aware of conflicting answers to the same question. Patients may feel the same discomfort if they are told things that conflict with their expectations, and GPs can help them accept the new information, either directly or by reference to further information. The alternative is that the patient will reject the new information and thus fail to learn.